Hello, my name is Dr. Lee Cohen. I'm the director of the Ammon-Pinizzotto Center for Women's Mental Health at the Massachusetts General Hospital in Boston, Massachusetts, and a professor of psychiatry at Harvard Medical School. And I'm delighted to have a chance to talk to you on the occasion of Maternal Mental Health Awareness Month. Maternal Mental Health Awareness Month has been an opportunity for me to reflect on my career dedicated to women's mental health. I think we've made amazing strides over the last decades, and I think we still have a ways to go. I've been thinking a fair amount about our work in the area of perinatal psychiatric illness and how far we've come in terms of being able to navigate with patients and clinicians in the community who look after those patients the safest ways to manage psychiatric disorder during pregnancy. I think complementing the work in the management of psychiatric illness during pregnancy has been the commitment to better understanding and the development of better treatments for postpartum depression, both in America and globally. Postpartum depression remains the most common complication in modern obstetrics. And we've come a long way, at least in this country, in terms of efforts to enhance the identification of women who are suffering from postpartum depression at such a critical time in the lives of their families. It is standard practice in almost every state in the country and has been clearly endorsed by professional organizations such as the American College of Obstetrics and Gynecology and the American Psychiatric Association. The good news about postpartum depression, in my mind, is that we have exceedingly effective treatments to manage postpartum depression. We have effective pharmacologic treatments, and we also have non-pharmacologic treatments that have clearly demonstrated efficacy for managing postpartum depression. Patients have very strong feelings about whether they may want to be treated with a medicine or whether they prefer a non-pharmacologic psychotherapy where there's an evidence base supporting efficacy, such as cognitive behavioral therapy. Unfortunately, the majority of patients do not get effective treatment. Essentially, there is a gulf between identifying those patients with postpartum depression and seeing that those patients get well. We think a lot about what the obstacles are to getting patients well who've been identified with postpartum depression. We know there are clear obstacles to getting well with respect to difficulties navigating our healthcare system. And we also know that for many, many patients, they feel isolated and they feel great stigma associated with feeling ill at a time when they have a sense that they should be doing much better. I think one of the paths of decreasing stigma is to educate our patients about postpartum depression and also to collaborate with support groups in the community and our colleagues who are treating those patients. I think there are many ways to educate patients about postpartum depression, and I'm so pleased to share with you that in the last several weeks, a new documentary has been released which shares the faces and voices of postpartum depression in America. I was privileged to be the executive producer on the documentary More Than Blue, now available on the major streamers. I want to finish today by talking about one of the most serious illnesses that we treat in women's mental health, namely postpartum psychosis. There's been such debate about the diagnosis of postpartum psychosis and where it should land in the diagnostic and statistical manual, the so-called DSM. I don't think that that's a fruitful debate or exercise. I think that what is most important is that we work with our colleagues who are in emergency departments and in the community to effectively treat those patients. I think the message for our patients who suffer from postpartum psychosis is that they have an exquisitely treatable illness, that it is preventable, and that well-being is easily recaptured, even on the other side of such a serious problem. May is Maternal Mental Health Awareness Month, and I think it is a terrific opportunity to take stock of the road that we have traveled in perinatal psychiatry and the strides that we have made. But I also think it's an opportunity to pause and to look ahead at the opportunities to do even better by our patients who may be suffering from maternal psychiatric illness so that we can maximize the likelihood of moms and families doing well. Thanks so much.